Hi, my name is Carolyn, and I am pelvic floor physical therapist with Verity Physical Therapy and Wellness. I'm the owner and the head physical therapist. I specialize in helping women navigate pregnancy and postpartum so that they can stay safe and healthy in their active lifestyles and also get back to their active lifestyles safely and efficiently after they have a baby. I'm going to be talking about hypopressives right now, explaining the concept behind them. They're a really wonderful exercise, especially pretty early on postpartum, to help prevent things like prolapse and incontinence. So hypopressives are utilizing the concept of pressure, negative pressure, positive pressure that is created by the diaphragm in the abdomen. So when we take a deep breath in, the diaphragm actually lowers down as you breathe in. So it actively lowers to suck air into our lungs, and then as we exhale, it actively relaxes back up into its position and it pushes air out. So breathing is actually the movement of the diaphragm up and down. Now, if you think of the abdomen, the core, as an enclosed system, when the diaphragm lowers to bring air into our lungs, it's actually creating a positive increase in pressure in our abdominal cavity, pushing down and out through our belly and down and out through our pelvic floor. When we exhale, it's actually coming up and it's creating almost like a suction, if you will, or a negative pressure as it raises back up to push air out of our lungs. So the diaphragm is coming from more of a flattened position and it's coming back up like that, almost suctioning things up. So hypopressives use that theory of the pressure going up and down to help, one, engage your pelvic floor muscles and to help kind of pull them up and pull the contents of our abdominal cavity up and in. So hypopressive is you take a nice deep breath in, so as you breathe in, your belly expands, and then you exhale all your air out. So as you exhale, the diaphragm's coming up like this. So as you're exhaling, you're pulling your pelvic floor up and in, you're engaging your abdominals up and in. At the end of your exhale, you then hold your breath for 6 seconds. During that breath hold, you want to suck up and in even more. So you're really like imagining Arnold Schwarzenegger when he would pose. He would pull up and in and try to expand his ribs and pull his diaphragm in so it whittled his waist. It made his waist look really small. That's what you're trying to do. So you're holding for 6 seconds, really sucking up and in, holding, trying to pull your pelvic floor up and in at the same time. And then at the end of the 6 seconds, you inhale, take a nice deep breath in, expand your belly, expand your pelvic floor, and then repeat. So again, it's a pressure system. As you exhale, the diaphragm's coming up. You're trying to pull your pelvic floor up and in. At the end of the exhale, you're holding your breath and creating even more suction. So pulling up even more, holding that nose, trying to suck air in more will help you engage up and in more. So using the negative and positive pressure that is created by our diaphragm to help us engage our pelvic floor and pull everything up and in and hold it nice and tight after we've had a baby.